Rosy t-shirt. Hello. Global Fund representatives, stakeholders, other partners. I see a lot of young people in the room. It's a good sign. Staff of CWM, invited guests, ladies and gentlemen, very good afternoon to you all. Indeed, as I look around, I think the heat is generating from the yellow, and the green is trying to offset it, probably the color of the environment. So we needed a balance. Anyways, we will not keep you long, and we do hope that today's event is going to be enriching, and of course, the main purpose of us to create more awareness about the use and abuse of antibiotics. And I'm sure each one of you will become ambassadors for this and take this message out to the public who are not present here. Please allow me to begin by saying Sir Alexander Fleming, the man who discovered penicillin, cautioned the world of medicine nearly 70 years ago. I quote, he said, "There is a danger that ignorant man may easily underdose himself and, by exposing his microbes to non-lethal qualities of the drug, make them resistant," unquote. Ladies and gentlemen, the danger that Fleming referred to is the beginning of the reality. Antibiotics resistance is now on our doorsteps. I'm very much pleased to be part of this second Antibiotics Awareness Week in Fiji. This global campaign of antibiotics handled with care is led by the World Health Organization, urgently calling all individuals, governments, and professionals to recognize the issue on hand and starting to take action to address it. And I think as you look at the t-shirts you're wearing, especially the yellow one, it's talking about one world and one health, which is very, very apt as well. Antibiotic resistance has been recognized as one of the greatest threats to health today. We are in the danger of losing the strength of our medical drugs. We are threatened with the loss of our first-line antibiotics, and we are facing the reality of common infections becoming harder to treat and cure. All these, ladies and gentlemen, are the result of us, individuals, not handling our precious resource, that's the antibiotic, with care. Although the development of antibiotics was one of the most important advances of medicine, we are starting to have a problem now. We have seen so many infections controlled with antibiotics. These infections like pneumonia, all sorts of skin infections, TB, whooping cough that had killed people before antibiotics was discovered. But now we know that because of the overuse and misuse, antibiotic resistance has developed, and those bacterial infections that were once treated or once easily cured with antibiotics are becoming harder to treat. To put it simply, antibiotics are becoming less effective than they used to be because of the resistance that develops when we use antibiotics wrongly or when it is not needed. The germs that cause infections get used to the antibiotics and they become ineffective, meaning the infection persists and may deteriorate. Ladies and gentlemen, this is not just a human problem. Antibiotics used in animals affects us too. For many years, it has been common for animals on farms to be given antibiotics when they are sick, supposedly to keep them healthy and help them grow faster. It has been estimated that globally, food animals consume more antibiotics than the entire human population, and nearly all the antibiotic used by humans are also being used in agriculture. But when farm animals become resistant to antibiotics, they can pass their resistance on to us humans in several ways: through direct contact, through the meat we eat, or when the manure they produce is used as fertilizer, or when it enters the water source or water supply. We have also learned that this continual exposure is one of the biggest contributors to the decreasing effectiveness of antibiotics. Ladies and gentlemen, it is not possible to keep on inventing new, stronger antibiotics, and we are really concerned that people could die of serious infections like they used to before antibiotics were invented. When we use antibiotics in a wrong way, or when it is not needed, bacteria have a greater chance of becoming resistant to that antibiotic in the future. We believe the problem can be solved, and we can all help solve it. We need to plan how to do it now. A study in African continent supported by World Health Organization that was published in March revealed that only 2 of the 50 African countries have national antimicrobial resistant plans, and only 7 of them have infection prevention and control programs. Fiji was one of the first countries in the South Pacific to have its national action plan for controlling antibiotic resistance, and that plan was launched last November. Together with the plan, Fiji also established a National Antimicrobial Resistance Committee in 2015 to steer the implementation of this national plan. Ladies and gentlemen, Fiji's National Antibiotic Resistance Plan has 5 strategic objective areas. The first part of the plan seeks to improve everyone's awareness and understanding of what antimicrobial resistance is and why we have to control it. We can do this with the help of the Consumer Council, who have great links with community people. Also, we can do it through education and training for health workers and community leaders, where knowledge can be shared about how to use antibiotics wisely and how to save them for the future. The second component is to strengthen nationally coordinated surveillance system. That means teaching health workers and community members throughout Fiji to look out for and report any evidence of infections that are not responding as they should to our antibiotics. Infection control is the third part of the plan. Improved infection prevention and control through good sanitation and hygiene. Even simple measures like good hand washing will reduce the incidence of antimicrobial resistance, because those measures control infections and help prevent their spread. The fourth objective, ladies and gentlemen, focuses on optimizing the use of antimicrobial medicine in human and animal health. Antibiotics are needed to control infections in animals as well as in humans. But as I've explained, there has been a practice of dosing animals with antibiotics continually, just in case they get an infection. That practice needs to be controlled, because it has been a big contributor to the development of the resistance we are talking about, not only in animals, but in us humans too. Similarly, we need constantly to remind our health professionals to make wise decisions when they consider prescribing antibiotics, and that's exactly what we intend to do. Health professionals also need to emphasize to their patients that there is not a pill for every ill. And antibiotics may, in very real sense, often do harm than good. Finally, the fifth objective refers to the need to establish good governance to combat antimicrobial resistance. That means setting up good systems to coordinate all the needed actions, as well as good communication and cooperation right through to all our communities. Ladies and gentlemen, the Antibiotics Awareness Week that was conducted in November last year gave an opportunity to provide information and to talk to as many people as possible through campaign activities. Some of you might have participated in the surveys that were conducted during the 2015 Hibiscus Festival to find out what people actually know about antibiotics. The people interviewed provided a lot of information that helped in the preparation of our Antibiotics Week and in our plan to control antibiotic resistance. In our mission to combat antibiotic resistance in Fiji, we are very fortunate to receive tremendous support from WHO and the Global Fund, and not forgetting the collaboration with the Consumer Council in creating awareness amongst our people. Ladies and gentlemen, here are things we can all do to reduce antibiotic resistance and therefore protect not only our future but the future of our children as well. We won't ask for antibiotics for cold and flu, because cold and flu are caused by viruses, and antibiotics have no effect on viruses. They are only effective for bacteria. We all will remember that antibiotics will not help us recover faster from viral infections. We should also know that we will only take antibiotics in the way they have been prescribed by our doctors. We will always take the complete course that the doctor has prescribed and not share our antibiotics with anyone else. And of course, we will make a greater effort to prevent the spread of germs by practicing good hygiene. This is the information that we want our general public to have. If you sit back and reflect for at least a moment or so, how many of us have actually done that? How many of us have actually completed our antibiotic dose? How many of us have passed on our antibiotics to the next member of the family when the doctor prescribes the same? You take a few and then say, okay, why should we buy it? Let's just share it. So these are some of the things that we need to know. As adults, as responsible members of our community, we need to guard, like I said, not only our own health, but our children's health and lives as well. So let's start acting for their health and future now. We can still have these life-saving medicines in future, but let's use it responsibly. Let's work together, let's use antibiotics responsibly, and let's support one world, one health. With these words, ladies and gentlemen, I wish us all the very best in trying to create more awareness about antibiotics and the need for us to use it and not misuse it. Okay, so thank you very much and God bless.
Honourable Minister for Health and Medical Services, Ms Rosy Akbar, and Permanent Secretary for Health and Medical Services, Mr Philip Davies. Members of the Antibiotic Awareness Week Organising Committee, development partners and invited guests, ladies and gentlemen. Good afternoon and happy Antibiotic Awareness Week to you all. And thank you for your invitation and very warm welcome here today. To begin, I'd like to express my sincere appreciation to the Ministry of Health and Medical Services for taking a leading role in celebrating this year's region-wide Antibiotic Awareness Week and for developing the Fiji National Antimicrobial Resistance, or AMR, operational plan. I'd like to acknowledge the continuous support and collaboration from the Fiji government, other key stakeholders and partners towards this success. The Antibiotic Awareness Week will increase awareness about antimicrobial resistance and promote the responsible use of antibiotics by engaging the general public, health professionals and policymakers, and of course the other sectors that are instrumental to protecting our antibiotics. Following the discovery of penicillin in 1928, other antibiotics were discovered and it went on to revolutionise healthcare as one of the greatest advances in medicine. As you're all aware, the rapid emergence and spread of antimicrobial resistance presents the healthcare system with significant challenges. But in many areas of the world today, the true burden of antimicrobial resistance is unknown. Just recently, the United Kingdom Prime Minister called for a review of antimicrobial resistant infections and commissioned research to actually estimate the burden of antimicrobial resistance and to project about what this might mean to us in the future. This study, the commissioned research, has estimated that at least 22,000 deaths attributed to antimicrobial resistance will occur each year in Oceania by 2015 if we don't act now. And with the highest antimicrobial resistance deaths occurring in areas of the world with a high prevalence of TB, HIV and malaria as underlying diseases causing immunosuppression. The study considered what they called a dark age of medicine, where medical and surgical procedures that we consider routine now and take for granted because of effective antibiotics will no longer be possible because of the high infection risk. In 2015, the World Health Assembly endorsed the Global Plan on Antimicrobial Resistance and urged member states to develop national plans by May 2017. The commitment was reaffirmed at the United Nations General Assembly high-level meeting on antimicrobial resistance in September of this year. This is a call for action to human and animal health sectors, agriculture and the environment, as antimicrobial resistance impacts both animal and human health, livelihoods and global economies. Implementation of these action plans will safeguard the effectiveness of antimicrobials and will facilitate the development of new medicines for both humans and animals. Fiji is the first country in the South Pacific to develop and launch both the National Antimicrobial Resistance Action Plan and Operational Plan, and will be a role model to others, not only in this region. So congratulations to everyone on this great initiative. Looking around the room, I can see key representatives from various agencies and other partners. As part of the One Health approach, you all play critical roles in implementing your multi-sectoral action plans to protect these precious commodities, antibiotics. This is just the beginning of our fight against antimicrobial resistance and doesn't end here. And as the saying goes, productivity is never an accident. It is always the result of a commitment to excellence, intelligent planning, effective monitoring, and focused effort. That is why your individual commitments and our collective commitments and focused effort is so important. We need to ensure that we put in place the plans, take the action that's been agreed, with an effective monitoring and evaluation process in place. We have to get it right. WHO will be with you every step of the way in implementing the National Antimicrobial Resistance Plan and will continue to provide technical support as needed. I wish the National Antimicrobial Resistance Committee and everyone all the best in taking your actions forward. And I also urge other partners to continue supporting Fiji in addressing antimicrobial resistance. And before finishing, it's really heartening to see those front rows of young people. If we get this right now, if we protect our antibiotics, hopefully we'll be leaving you with a legacy of these miracle drugs that will continue into the future. So thank you, and Binaka Batalangu.
Pull this one, I pull this one.
Yes,
You have one each.
We have one each. You hold the bottle. Since actually.
Yeah.
So, you give one to us?
Squeeze it.
That settle. Okay.